Welcome, medicos. Let's begin with this quote. You are an artist. Make your life your masterpiece. Hepatitis E. Today we will be discussing about hepatitis E. So this is a very small topic, generally appear as a 5 marker and sometimes in MCQs. So let us see with this particular table. So the virus name is hepatitis E virus. The genetic material is RNA. So this is an important point. Belonging to family Calciviridae. Mode of transmission is fecal-oral route. Then the clinical manifestation is acute hepatitis and it is a non-enveloped virus. We'll read a little detail about the clinical manifestation. And also one thing about the family, although this HEV resembles the calciviruses, taxonomically it is distinct from them. Hence, they have been assigned to a unique genus now, Hepavirus, under the family Hepaviridae. Now let us talk about little morphology. So it is a small virus, 30 to 32 nanometer. It is a non-enveloped, as I mentioned here, so it is an important point. It can appear as an MCQ. Icosahedral symmetry, and the RNA is positive sense single-stranded RNA and have a specific antigen, HEV antigen. So it contains positive sense single-stranded RNA and specific antigen, that is HEV antigen. Positive sense viral RNA means the viral proteins can be directly translated from this RNA without requiring an intermediate transcription step. So it can be directly translated. Let's talk about the clinical manifestation. So before beginning, we'll talk about the incubation period. So the incubation period here is 14 to 60 days. And there is a Viva question where they ask, what is incubation period? So incubation period means the time duration between the exposure to the pathogen and the appearance of the first symptom. So that is incubation period. Now, the most common manifestation of HEV is self-limiting acute hepatitis. So it's acute hepatitis which is generally self-limiting. In 1 to 2% cases, it can also manifest as fulminant hepatitis. But there is one thing that in pregnant women, the risk of this fulminant hepatitis is higher, 20% risk as compared to this 1 to 2% risk. So in pregnant women, there is higher risk and there is no chronic infection or carrier state of this infection. So let's talk about the laboratory diagnosis, which is very important in any microbiology question. So first, the HEV RNA by reverse transcriptase PCR, it can be detected in stool or serum sample. Then the HEV virons by electron microscopy. The important thing here is these two can be detected in the stool and serum sample even before the onset of clinical illness. So this is an important point. Then we have serum antibody detection by ELISA. So first of all, like IgM anti-HEV, it appears in the serum simultaneously with the increased level of liver enzymes, indicates acute infection. So this IgM anti-HEV indicates the acute infection. Acute is related with IgM. And when we see IgG anti-HEV, that is when it replaces the IgM in 2 to 4 weeks once the symptom is resolved and it persists for years. This indicates recovery or past infection. So if we are detecting IgM anti-HEV, that means it's a acute condition, acute infection. And if we are detecting IgG anti-HEV, this indicates recovery or past infection. So for treatment aspect, there is no specific antiviral drug available for this. Now let us revise. So the virus is HEV, hepatitis E virus. RNA is the genetic material, single-stranded RNA. It belongs to family Calciviridae. Mode of transmission is fecal-oral route. Then clinical manifestation is acute hepatitis, and 1 to 2% cases we have fulminant hepatitis. But in pregnant women, the risk is higher for fulminant hepatitis, that is 20%, and it is a non-enveloped virus. So this is the recap. Hope it was helpful. We'll get back to you soon. Laugh, learn, and live. Thank you.